Cogleap is dedicated to empowering children with ADHD, ASD, and other development challenges through innovative cognitive training and therapeutic interventions. We believe that every child, with the right support, every child can thrive. As part of our commitment to the families, we host monthly expert-led webinars covering intervention strategies, family support, and advocacy topics, just like tonight's event. Our recent events include Professor Lily Chen's speech on communication and neurodiversity, and Dr. Albert Knapp's speech about ABA therapy. And our BCBA and NATLI just had a coffee talk about how to the importance of modeling in child's development. So we have a lot of great events that on the road. And if you are interested in those events, feel free to please check our website and newsletter for our upcoming events. Okay. Now, let me ask you. So have you ever left an IEP meeting feeling that you're frustrated or confused or unsure what to do next? So if you feel that the same feeling as I felt, you are at the right place. So that's exactly why we are here today. We are honored to have with us Jennifer Chang, an experienced special education attorney who has dedicated her career to helping families understand their legal rights and advocate for their children's education. Tonight, she'll walk us through IEP essentials, alternative options, and how to hold schools accountable. Okay, without further ado, let's give Jennifer Chang a warm welcome.
Okay, so my name is Jennifer Chang, and I only practice special education law. So what that encompasses is that I represent families with children with special needs against the public school district. So if you have a child who is in college or have aged out of the public school system, then I am not able to help you, because once you age out of the school district, then the regional center is responsible for providing the services for that individual. So I'm going to talk about what an IEP is and just the general terms and assessments that parents should be familiar with in order to better advocate for their child in the IEP meeting. Next slide, please. So what is an IEP? So IEP is essentially a legal document. It is a contract between the parent and the school district on how the student is going to be educated and what kind of services the student is going to be receiving. So anything that has to do with goals, accommodations, services, it must be written into the IEP document. For example, if it was discussed at the IEP.
Please mute yourself. Okay.
Okay. So if, for example, during an IEP meeting, the team and the parent had a discussion about, let's say, oh, the student is going to receive one-to-one aid support for transition periods, then that must be outlined in the IEP document somewhere. If it is not, then the district is legally not required to provide that support. I wrote these, so in an IEP document, all of these, like the eligibility has to be written. So why the child is receiving IEP support. Present levels, that has to do with where the child is functioning today at the time of the IEP meeting. And this is important in order for us to, at least for the team, to draft goals. The present levels will talk about the child's strength and the child's weaknesses. So for example, like let's say we're talking about reading. The present level should discuss like the level that the child is reading, their fluency, their accuracy, and their reading comprehension. And then based on that, whatever deficits they have, goals should be written to address those deficits. Accommodations has to be clearly written so that the teacher understand what kind of accommodation the child requires. Accommodation section is really not a problem or it doesn't really come into play as a challenge during, let's say, when a child is in elementary school, because during that time when you're in elementary school, you only have one teacher. So that one teacher attends the IEP meeting and understands what kind of accommodation the child requires during school hours. But once the child goes into middle school and high school, she or he will probably not have just one teacher. There's going to be many teachers. And all of these teachers have to understand what kind of accommodations needs to be in place. And this is important for students who are on the higher functioning side that requires, let's say, a different room to take the test, more time to complete tests and to turn in assignments. The child is able to use notes during exams. Things like that, if they're very specific accommodations, then it's important for the parent and the IEP coordinator to remind all the teachers of these accommodations. Related services are also important. These are basically speech, OT, one-on-one, SAR, RSP, depending on which district you're at. It's going to talk about what type of services the child is going to receive. So for example, if the child is going to receive 60 minutes of speech and language per week, it needs to specify how that 60 minutes are going to be allocated. So is it going to be twice a week for 30 minutes? And if so, is it going to be pull out or push in? Is it going to be individual or is it going to be in a group setting? So all of that has to be identified in the IEP document. If not, then the speech pathologist has a lot of leeway to provide that service as they see fit. So for example, if it just says 60 minutes per week and it doesn't specify how that 60 minutes is being provided, then the speech path could essentially just go into the class for 1 hour and just stay there or work with the student or work with students. And that means they provided the service. It has to be clearly written. So that is important. Placement is also important. So if your child is in gen ed and they're being pulled out for RSP, like where is the placement? Is it general ed? Is it at a non-public school? Is it SDC or is it like a residential treatment center? So that placement has to be written into the document. And of course, the meeting notes are important too, but I always tell parents, don't focus too much on what is written on the meeting notes. And here is why. During the meeting, you talk about so many different things going back and forth, especially if it's like you're arguing or you're trying to advocate and there are many people providing input. It's very difficult for the note taker to capture everything in a written document. So I tell parents, it's better for you to notify the IEP team 24 hours in advance in an email saying, hey, I'm going to audio record the IEP meeting, audio record it. That way, later on, if something happens and the meeting notes are not clear or you have to, you're in court and you're fighting over what the document says, we can rely on the audio recording as opposed to what's written in the document. I see many times family fight over so the family refuses to sign the IEP document for implementation because the IEP meeting notes are inaccurate and they're fighting for months trying to fix it. Most judges will find that it's the parents' fault that the IEP could not be implemented. Notes are not, I mean, IEP implementation, I think, is more important than fighting about the notes. And here's the thing, the teacher only has so many hours in the day to teach and to work on IEPs and goals and other students. So for you to keep going back to fix the IEP meeting notes, it's not gonna look well. It's not, the judge is not gonna look kindly upon it. Like basically the parents are dragging and wasting time. So I just tell parents, audio record. Who cares what the meeting note says, as long as the goals and services are clearly written for them to work on, and you can kind of hold them accountable for that. Next slide, please. So these are the eligibility criteria. You know, ASD is, I think, by far it's the most used, I guess, eligibility. Then it's specific learning disability. So specific learning disability has to do with, it's a kid who has, you know, average to above average cognitive abilities. And then you look at their academic testing, it's average. And then there's like, you know, different scatter scores. So like, for example, reading fluency is average, reading accuracy is average, but reading comprehension is like below average. When you look at math calculation is average, but math comp the math writing component that has to do with word problems, it's below average. You look at writing, like spelling is horrible, like writing is not good. So for a kid who has average abilities, why is it that they're not able to perform and there's a disconnect, right? So that's where the specific learning disability is. I disagree with, I think, you know, they need to change this eligibility. Generally speaking, SLD falls under, anyone that's like dyslexic falls under SLD, but school districts refuse to use the word dyslexic, because if you have dyslexia, there are different types of intervention that has to be put in place, and the school districts are not equipped to provide that intervention. So they just put it in one umbrella and call it a specific learning disability and kind of group all the kids together. OHI is generally students with ADHD that falls under other health impairment. Emotional disturbance, this has to do with like severe depression, anxiety, like their mental health is like so debilitating that the student cannot access their curriculum. Speech and language impairment, that has to do with language, expressive, receptive, pragmatic. But if you have an ASD eligibility, generally SLI falls under ASD because students with autism generally do have speech and language impairment. So sometimes I see both, but ASD kind of covers that. SLI, I see used a lot for little kids who are coming from regional center at the age of 3 and being referred out to the school district. Because the kid is so little they cannot assess for ASD, but they do see the language deficit. So they would you know, find the eligibility under SLI, and then when the child is ready for a new evaluation, when they're like 4, 5, 6, then they can fall under the ASD. Intellectual disability is when the cognitive is, you know, below the 50th percentile. If a child is 6th grade and below, I tend to fight the district on this ID eligibility, and here is why. Once you have that ID eligibility as your primary, secondary, or even as your third eligibility, school district's position is the child is unable to learn, so there is no expectation from the student. The goals are going to be written extremely low. When you go into IEP meetings saying, oh, he can do more, she can do more, like, why isn't the child making progress? When you start making these arguments to the teacher and to the service providers, they're going to use this ID eligibility as a shield and say, basically, your kid doesn't have the cognitive ability to learn. So this is the best they're going to do. And I disagree with that because I think at least till like 12 or 13, their brain is still developing and they may learn differently than their peers. Like, for example, even though cognitive, because they don't have the language acquisition, their cognitive IQ may be low, their nonverbal IQ could be higher. And I've seen it where if you just do a straight cognitive IQ testing, it comes out low. But when you take the heavy language component out and we do the nonverbal cognitive testing, the students are actually scoring higher. So that tells me, and I can advocate for the child saying, look, he or she just learns differently, so you cannot use this ID eligibility, and it's something that I push hard to fight for and get out. If you have the autism, then you should stick to autism and take the ID eligibility out. ID should not be in there. Multiple disability has to do with global deficits, like, the child requires a feeding tube, they have orthopedic impairment, wheelchair bound, the child can barely sit still, like medically fragile students fall under multiple disabilities because there are just so many areas of need that needs to be addressed. Next slide, please. So these are the related services and the goals, somewhat the goals that should go along with services. You hear it in the IEP meeting all the time, like, oh, goals drive services. So in order for you to get speech and language services, you need goals to go along with the speech services. So these are just major, very big picture areas, and you guys have, and parents and the IEP team has to fine tune it depending on what area of needs are. So for example, like in speech, generally we address receptive, expressive, and pragmatic language. So you need to have goals in those three areas. And that does not mean you can only have one goal in each area. Some students require more than one, like pragmatic language may require three. If the child has strong receptive language skills, but expressively they're not able to say the words or they're not getting it out, then we may have more expressive language goals as opposed to the receptive goals. So it gets really tailored into what the child needs. And this is why the present levels is so important, because we need to see where the child is functioning. OT, generally it's fine motor, gross motor, and your sensory diet. Fine motor is easy to know whether the child is weak or not. It's like fine motor skills. Is the child able to use a zipper? Is the child able to hold a pencil and write their name? Are they able to like glue anything, scissor? Like these are fine motor skills. Gross motor has to do with, can the child, basically safely navigate the school grounds up and down the stairs, go to like the playground. If that's not an issue, then we don't need gross motor skills. Most districts only look at fine motor and gross motor when they look at OT. But as we know, students with autism and even ADHD students, there's a lot of sensory diet that needs to be embedded into the program. So you hear this all the time at the IEP meeting too, like, oh, what kind of sensory tools or like things that you can provide so that my kid can go ahead and, have the ability, sit for longer periods of time and learn. They'll say, oh, these sensory diets are embedded into the program. That is not going to work for your kid if the child requires specific sensory diets. So for example, if Your child could sit for 5 minutes and then they need to get up and get that sensory diet in and come back. That has to be specifically written into the document, and you have to talk about what movement break is going to happen. Some kids like swings, some kids like to walk, some kids like to jump, some kids like to, they have like these weight vests that helps them too. So depending on what that is, that should be clearly written into the IEP. Also, some school district and some schools have what's called a clinic-based OT. So there's a separate room dedicated for like these apparatus that the child could go in and utilize. I see this, I mean, there aren't that many schools, but the schools that do have these clinic-based OT rooms are generally elementary schools for little kids. So if your school has it, it's on campus, you should fight for it and try to get that in, because these sensory movement breaks are so important for the kid. It really does help them calm their body down, because they don't know how to calm their body down because it's just the body physically reacting and they can't shut it off. So they need to go and have the body react and then come back and work on the academic task. I think there was a typo. APE is similar to gross motor. Is the child able to kick a ball, catch a ball, throw a ball? You know, your typical PE that's required for students. So if the child has these deficits and early on, like let's say the student is in third grade and you know that, when they can't skip, they can't run, or they cannot jump. Like if that's you see those areas of weakness, then you can ask for APE evaluation and get those services in sooner rather than later. Because again, this is kind of a movement thing, and the kid actually, I see students benefiting a lot of movement because that also has to do with sensory. Counseling. So counseling services are only appropriate if the student is able to communicate how they're feeling and whatnot. So I sometimes see like a nonverbal student with counseling services, and how is that going to benefit the student other than they're just providing a useless service, in my opinion. So when you're asking for counseling services, it has to be like, is it really going to benefit the student? Can the student does the student have the ability to tell somebody, an adult, that, this is how they feel at school, they need help doing X, Y, and Z, and can that counselor be the liaison between the student and his or her teachers to bridge that? So if it's beneficial, then I think it's worth getting. Wraparound services has to do once there's a significant school refusal. This has to do with like older kids who are basically, they don't want to go to school. They have very low self-esteem. There are a lot of disciplinary issues. Parents are unable to control. This is when the social worker comes in to help kind of support that. So the social worker works with the home and the school setting to get the student try to get the student to school. Generally, wraparound services, I don't see much success. If there's that much school refusal, there's a lot more going on with the student, that having a social worker come in is not the trick. Next slide, please. So when you determine placement for a student, the law is the least restrictive environment. So that means the child must be educated alongside their general education peers as much as possible. So, it's either 100% in gen ed, 80% in gen ed with pull-out services. That's the RSP. SDC, NPS is, restrictive, and the most restrictive is the RTC, because that's a residential treatment center. So the student doesn't come home. They're living at a treatment center for like 6 months to a year because they need that much structure. Next slide, please. These are the different types of evaluations that's available. There may be more, but these are the ones that I use a lot, and these are the ones that are most commonly used. So psychoed is your basic, everyone gets a psychoed evaluation to determine, what their cognitive academic levels are and their functioning. So, it's just like when you go in for a physical every year, the doctor just goes and runs everything, right? Your blood work and how you're doing, so that's kind of similar to a psychoed. FBA looks at the function of the behavior. So, for example, if there's a lot of school refusal or eloping or task avoidance, I think it's kind of good to get the FBA done to see like why the task avoidance or these behaviors are happening and how we're going to provide that intervention. One thing I didn't write here is some districts also, so a lot of times this is like I want to say up until pre-pandemic, if you wanted to get a 101 aid for the child, you would have to go through an FBA. But now some districts also require another type of testing called SKIA. And so that looks at whether the child requires a 101 aid. In my opinion, there's no difference between an FBA and a SKIA, but the only reason they're doing a SKIA is it's only for delaying purposes. So what I would recommend parents to do is if your district is known to do SKIA and you want to get a 101 aid and let's say at the IEP meeting you're saying, these behaviors are happening, it's concerning, it's disruptive, and you want a 101 aid, and if the team says, okay, well then we have to do an FBA first, I think that's your cue to say, okay, not only do I want an FBA, then do the SKIA at the same time so that we don't waste any more. I don't have to wait another 60 days after that IEP meeting that we review the FBA to say, okay, well, he has all of these behaviors and it's concerning. And then at that point, when you ask for a 101 aid, they're going to say, okay, we have to do a SKIA now. So FBA, automatically you just say SKIA. Some teams will tell you, oh, we don't have to do SKIA if we need a 101 aid. If FBA says he needs it, she needs it, then we'll give it to you. You have that in recording, so you just have to do the FBA. The ERMs and ERICs, depending on which district you're at, these are the same thing. It's educationally related mental health services. So in order to get the counseling support, you have to go through this assessment to see what kind of emotional need the child has. Is it anxiety? Is it depression? And what's causing it? And how do we address it in the school setting? So remember, in order to get these services, it has to affect the child's academic. If let's say I just want my son or daughter to get these counseling support because he or she's also in outside therapy and I think it will be beneficial. If the child does not have an issue or a problem accessing their curriculum, then you will not be able to get the services. All of these services are provided because without it, the child cannot access it. So that's why they're being provided. CAPD is the auditory processing disorder. So when you go through the psychoeducation evaluation, there's a component in the cognitive testing that deals with auditory processing. So they touch upon the processing issue. So if the child scores low on the auditory comprehension or auditory language component test, then you also do a speech and language, and speech and language also touches upon the oral comprehension. And if both of those oral comprehension scores are low, then you need to ask for a CAPD because this is not a hearing thing. The information that the student is listening to is not going into the right files in their brain. So that is going to be a problem in an educational setting because when a teacher is providing instruction orally, the child is unable to understand. So when it's time for them to do independent work, they're unable to do it because they hear what the teacher is saying, but it's not going into the right file. There's interventions to fix that. So that's why CAPD is important. Some districts will say, oh, CAPD these are medically, related things, so you have to go through your health insurance, but that's not the law. Generally, they'll say that because districts don't have people to do the auditory testing. You need an audiologist to come in and do it. This is not somebody like a school psych who can administer the test. Vision therapy has to do with the vision processing. So again, when you do the psychoed, and sometimes it's also in OT, they do the visual measures. I forgot it's called VMI. That has to do with you're looking at it requires the student to look at the shape, and then they're supposed to copy that shape. So when you see that, let's say the picture is a square, but the child is unable to replicate the square, then what they're seeing, they're not seeing the square in with their eyes. This has nothing to do. So this is where it gets tricky, because the OT will sometimes say, oh, they're not able to draw the square, or she or he's not able to draw the square because of fine motor issues. But also, it could also be that they're not seeing the square, they're seeing a different shape. So if that is the case, then they're gonna need vision therapy. And this is not something you go through like there are only I only know like two or three in state of California that does this for educational purposes. So these are interventions that has to be placed. And again, just like the audiologists, school districts are not, they don't have staffing to provide this, and they'll just say, oh, that's a medical thing, so go get your vision test done. But it's not vision. It's not that they cannot see. They're not processing what they're seeing. So it's not a square. So that's why we get this evaluation done. Academics generally fall under psychoed. The only time, I think in my 10 plus years of practice, I think maybe like 10 times I've done just straight academic evaluations only. When I knew that this child it was screaming dyslexia. Like that's it. There's no other issue other than dyslexia. Nowadays, I don't just see dyslexia. There are other components. So that's why we don't do straight academics. Vision therapy and visual processing is the same thing. It's just a different way of saying it. Next slide, please. So these are the laws under the IEP, IDEA. IEP, there's an annual IEP. It must be reviewed every year. The progress monitoring, when you look at the goals, they say, oh, this is a 1 year goal, and then they divide it into like three separate progress reports. The district has to send you, or the IEP coordinator has to send you at every period where the child is making the progress or not, so you can keep track. Triennial assessment is supposed to happen every 3 years. IEP is a written document. Everything has to be written into it. If whatever is written into is not being followed, then there are legal consequences. And IEP there's statutory timelines. So for example, if a parent requests an IEP, like an assessment, right? Let's say I want my child to be assessed for CAPD. The district has 15 days to respond to you. And if they do provide you with an assessment plan and you sign it, from the date you sign the assessment plan, they have 60 days to complete the evaluation and hold an IEP meeting. Next slide, please. So how do you prepare for it, right? When they give you a meeting notice, you have to make sure you know what the purpose of the IEP meeting is so that you can prepare. If it's an annual IEP, then you understand that, okay, then we're going to be looking at past goals and draft new goals. And then you can kind of prepare that way. If it's a triennial IEP, then you know that they're going to review these assessment reports, and most parents, even if they do English as their first language, when you look at the assessment report, you have no idea what it is saying. So to get it at the time of the meeting and to go over it, I think it's not beneficial for you. It's important to ask for these draft report, even if they're just draft, to get a copy of it, review it, think of what questions you have in case I'm not saying ask questions, you don't always have to ask questions, but you want to be prepared as to if you don't understand something, what the test is saying, then you need to be prepared to ask the questions then. So I think it's important for you to review it beforehand. You need to record audio record. You could not video record, only audio recording is available. And in order for you to do that, you must notify the district in writing 24 hours in advance. So I advise parents when you get the meeting note, I mean the meeting notice of meeting, and when you check off like I will attend, anywhere in the document, just write I will be audio recording the IEP meeting, so you don't have to worry about the notifying the school district anymore. It's all in that document, and they can't say, oh, I didn't receive the email, so I didn't know you were audio recording, so you can't audio record. Like they won't be able to send that to you. It's clearly written. You've already, you just knock it out of the way. You ask for drafts prior to the meeting, and you don't have to sign the IEP document. Sometimes they'll say like, oh, so do you agree? Because unless you agree, we cannot implement these services. It's just 1-2 days delay. I would say if a lot of information was shared and you're still confused about what was discussed and what they're offering, it's important for you to just ask for the document, take your time reviewing it, and then signing. And especially if you are using an interpreter and the interpretation is not done correctly, then there's a lot of misunderstanding that happens. Like I see it, I speak Korean, so when I don't provide interpretations during the IEP meeting, but I see how the interpretation is done, so I catch it. So for example, I see sometimes the interpreter will just summarize, like just take everything out, all the important things out, and just tell the parent. They say they're going to give it to you. So how does that benefit my client? It does not. So I would have to stop the IEP meeting and I would have to tell the interpreter to interpret everything. So if that is the case and you are using an interpreter and the interpretation is not good, you again want to take the document home, and there's Google Translate. A lot of my parents are savvy that way. They'll copy paste into the Google Translate and they'll study it that way, and then if they have questions then they'll follow up. But I think it's really important for you to understand what the document is saying and what they're offering to work with your child. Next slide, please. So I'm not a big fan of 504 plans. I rather push and fight for an IEP if possible. 504, you don't have a lot of legal protections that you do under an IEP. So there are no statutory guidelines. There's no timelines. If the accommodations are not followed, it is very difficult to hold the school district liable, because the court that you're going into is very different from an IDEA type of situation. We're not going into for due process. You can't go into due process under the IDEA anymore. You will have to go to district court to fight it. And that gets, number one, very, very expensive to do. And number two, there aren't that many remedies out there for the child, unless the child got like I hate to say it like this, but unless the student died because they didn't provide the appropriate accommodation. So generally, the only time I would do a 504 if it has to do with, if it's just strictly for medical purposes, like the student has no problem going into gen ed. In fact, the student is taking like AP honors classes, no problem, but they just need accommodations because of their medical condition, like diabetes, asthma, allergies, Crohn's disease. If that is the only reason, then I would push for a 504, because this is so much easier to do that way. But if there's more than that, you should not, if anytime you have a 504 and they're providing services, then that's not a 504 plan. You need to make sure they switch it out to an IEP. 504 does not provide services. It's only accommodations. So in order for the student to access their general education curriculum, and accommodations are more time on test. They get to take a test in a different room. If they have these medical, like for example, if they need someone to monitor their type 2 diabetes, they need an LVN to come in and give them an insulin shot. Asthma, same thing. Like if this happens, they need to take something like where a lot of nurse involvement, then it's a 504. Next slide, please.
Okay.
That's it. That's
Yeah.
all.
Thank you, Jennifer, for such an insightful presentation. We really appreciate it. I'd like to introduce some of our core services, so you get a more you can learn more about how we provide to the children and families. At Cogleap, we specialize in ABA therapy. It's a evidence-based intervention that can help kids with ASD thrive. So currently we provide in-clinic service in Irvine, and both in-clinic and home-based service in San Jose. And we have our Walnut and Beverly Hills centers coming soon. We also provide an innovative AI-powered drug-free intervention system that's called HFS Cognitive Training that's tailored to children and adolescents with ASD, ADHD, or other developmental challenges to improve focus, emotional regulation, behavior, and communication. The last service we provide is VCAT assessment, which is virtual classroom attention tracker. So it's a 13-minute VR-based assessment tool that can assess attention and impulsive control in children and adolescents. So it provides a quick and objective and comprehensive view to further guiding the training plans. So those are the services we provided. And on the right side is our contact information. You can call us or email us or search on our website. We headquartered in Irvine, and we also have a neurodiverse kids support group in our Facebook. So if you just scan the QR code here, you could join our group. Okay. I'd like also introduce our upcoming event. So just now I mentioned that we provide 3 kinds of services, and HFS is our proprietary intervention system that can help kids with ASD, ADHD, and other developmental challenges. So in this upcoming event, we invite our Director of Research and Development at Cogleap to introduce this system in deep depth. And we will, some of the workshop highlights include, like, we will understand ASD, ADHD brain functioning and how HFS could enhance brain development, and some of the core therapeutic elements of HFS and the proven results we get from our data and center. So if you are interested in this kind of intervention system, please scan the QR code here and register. It's on March 12th, 2025 at 7 to 8 p.m. Okay. Those are our social media accounts. So if you want to scan those QR code, you can also join our social media.